Imagine your body is like a bustling city. Roads carry vital supplies, workers rush to fix damage, and security forces stand guard against invaders. Now imagine one of the main highways gets clogged, delivery trucks can't get through, repair crews slow to respond, and the guards grow tired, distracted, less alert. Over time, trouble starts to spread. Small threats go unchecked. One day, something sinister takes root in a quiet corner. By the time anyone notices, it's already grown strong, shielded by the very guards meant to stop it. This isn't science fiction. It's what happens when blood flow in the body is cut off, not just to the heart or brain, but even to places like the legs. And now, scientists have discovered something startling. When circulation falters, it doesn't just raise the risk of heart attacks or strokes. It can also quietly accelerate the growth of cancer, weakening the immune system in a way that mimics aging. The body doesn't just struggle to heal, it becomes more welcoming to disease. New research reveals that when arteries narrow due to plaque buildup, often from cholesterol and inflammation, blood can't flow freely. This condition, known as ischemia, is commonly linked to peripheral artery disease, a silent but widespread problem affecting millions. People might notice cramping when walking, slow-healing sores, or cold feet, but often, they don't realize how deep the damage goes. Now, evidence shows this lack of oxygen-rich blood doesn't just harm the legs, it sends shockwaves through the entire immune system. In experiments with animals, scientists created a situation where blood flow to a limb was temporarily restricted, simulating what happens in peripheral artery disease. These animals had breast tumors. What they found was alarming. Tumors grew at twice the speed compared to those with healthy circulation. Even more surprising, the change wasn't just local. The entire body shifted into a state that made it easier for cancer to thrive. The reason lies deep within the bones, specifically, the bone marrow, the body's immune factory. This soft, spongy tissue is where all blood cells are born, including the white blood cells that patrol the body looking for danger. Under normal conditions, the immune system maintains a delicate balance. Some cells rev up to fight infection or destroy abnormal cells, while others calm things down to prevent overreaction. It's like having both firefighters and safety inspectors, both essential, but one can't dominate without consequences. But when blood flow drops, that balance collapses. The bone marrow begins producing more of the calming, suppressive cells and fewer of the aggressive fighters. It's as if the city's security force suddenly replaced its special ops units with peacekeepers who hesitate to act. The result? A weakened defense system that no longer recognizes cancer cells as threats. Instead of attacking, the immune system starts shielding the tumor, creating a safe haven where it can grow unchecked. And it gets worse. This isn't a temporary glitch. The changes go beyond what cells are made, they reach into the very blueprint of the cells themselves. Genes that should activate to fight disease become harder to access. The structure of DNA inside immune cells gets rewired, like a library where the books on defense tactics have been locked away. Even after blood flow is restored, many of these changes persist, leaving the body in a long-term state of vulnerability. What's particularly alarming is that this process looks almost identical to what happens as we naturally age. The immune system weakens over time, a phenomenon called immunosenescence. Older adults are more prone to infections and cancer not just because their bodies wear down, but because their immune defenses lose their sharpness. Now, scientists realize that poor circulation can trigger the same decline years or even decades earlier. In effect, blocked arteries don't just age the heart, they can age the immune system prematurely, making the body behave like that of someone much older, even in younger individuals. This discovery bridges two major health crises that have long been studied in isolation: heart disease and cancer. For years, doctors have noticed that people with heart problems often face higher cancer risks, and vice versa. But the connection wasn't clear. Was it shared risk factors like smoking or poor diet? Was it just bad luck? Now, evidence suggests there's a deeper biological link, a hidden pathway where damage in one system quietly sabotages another. Think of it like a domino effect. Fatty deposits build up in arteries, reducing blood flow. This causes low oxygen levels in tissues, triggering inflammation. That inflammation doesn't stay put, it spreads signals throughout the body, reaching the bone marrow. There, it alters stem cells, changing the type of immune cells they produce. These new cells travel through the bloodstream, some ending up in tumors, where they don't attack. Instead, they help build a protective shield around the cancer, blocking other immune cells from getting in. The tumor, once vulnerable, now has armor. Even more troubling, this immune shift isn't limited to one type of cancer. While the study focused on breast tumors, the mechanism is systemic, meaning it affects the whole body. That raises concerns for other cancers too. Prostate, lung, colon, any existing or emerging tumor could benefit from this weakened defense. And since peripheral artery disease often goes undiagnosed for years, the immune system could be compromised long before anyone realizes there's a problem. The implications are huge. This isn't just about treating cancer once it appears. It's about rethinking how we prevent it. For decades, cancer prevention has focused on avoiding carcinogens, getting screened early, and living a healthy lifestyle. All of those still matter. But now, there's a new factor to consider: vascular health. Keeping arteries clear may not only protect the heart but also preserve the immune system's ability to police cancer. And that changes everything. It means that a cholesterol test or a check for leg circulation isn't just about avoiding a heart attack. It could be a way to stop cancer before it gains ground. It means that treating high blood pressure, managing diabetes, and staying physically active aren't just good for the heart, they're essential for immune resilience. It means that a walk around the block isn't just exercise. It's a way to keep blood flowing, oxygen moving, and immune cells sharp. But here's the catch: the body doesn't always send clear warnings. Peripheral artery disease is often called silent because symptoms can be mild or mistaken for normal aging. A little leg pain when walking? Maybe you're just out of shape. Cold feet? Blame the weather. But inside, the damage may already be underway. The immune system could be shifting, quietly, without any obvious signs. By the time a tumor is found, the defenses may have been compromised for years. That's why early detection matters more than ever. Simple, non-invasive tests, like checking blood flow in the legs with a blood pressure cuff, could become part of routine health checks, not just for heart patients, but for anyone concerned about long-term disease risk. And for those already diagnosed with circulation problems, it might be time to rethink their care. Could treating vascular disease more aggressively also lower cancer risk? Could anti-inflammatory drugs, already used for heart conditions, help reset the immune system before damage becomes permanent? Researchers are now exploring whether existing medications can interrupt this dangerous chain reaction. Some drugs reduce inflammation in blood vessels. Others target specific immune signals that go haywire during ischemia. The hope is that by calming the body's response to poor blood flow, we can prevent the immune system from turning traitor. It's not about curing cancer directly, but about removing the conditions that allow it to grow. This also opens new doors for prevention. Imagine a future where people with poor circulation receive not just vascular care, but immune monitoring. Blood tests could track the balance of immune cells, spotting early signs of dysfunction. Lifestyle programs could be tailored not just to lower cholesterol, but to maintain immune youth. Exercise, diet, stress reduction, these aren't just general advice. They could be precise tools to keep the bone marrow producing the right kind of defenders. And what about recovery? After a heart attack or a period of severe ischemia, the body is in crisis. Doctors focus on stabilizing the heart, repairing damage, preventing another event. But what if part of recovery should also include protecting against cancer? Could a rehabilitation program include immune-boosting strategies? Could patients be followed not just for cardiac health, but for changes in their cancer risk? The connection between circulation and immunity also sheds light on a mystery that's puzzled doctors for years: why some people respond poorly to cancer treatments. Immunotherapies, which train the immune system to attack tumors, have revolutionized care for many. But they don't work for everyone. Could it be that in patients with underlying vascular disease, the immune system is too worn down, too reprogrammed, to respond? If so, fixing blood flow, or using drugs to reverse immune aging, might make these treatments more effective. This research doesn't just change how we see disease. It changes how we see the body itself. We used to think of organs and systems as separate: heart doctors here, cancer specialists there. But the body doesn't work that way. It's a network, an ecosystem, where a problem in one area ripples outward in ways we're only beginning to understand. The legs aren't just for walking. The arteries aren't just pipes. They're part of a living, responsive system that influences how we age, how we heal, and how we fight disease. And that means our approach to health has to evolve. We can't just treat diseases when they appear. We have to protect the body's defenses before they break down. We have to see heart health and cancer prevention not as separate goals, but as two sides of the same coin. A healthy artery isn't just a clean pipe, it's a lifeline for the immune system. For ordinary people, the message is both urgent and empowering. You don't need to wait for a diagnosis to act. The choices you make every day, what you eat, whether you move, how you manage stress, aren't just about avoiding one disease or another. They're about maintaining the integrity of your entire internal environment. Every step you take improves circulation. Every healthy meal reduces inflammation. Every effort to lower blood pressure helps keep your immune system young. It also means that if you or a loved one has been told you have poor circulation, it's not just a foot or leg issue. It's a full body warning. And it's not too late to respond. Getting treatment, staying active within your limits, following medical advice, these aren't just about feeling better today. They're about protecting your body's ability to defend itself for years to come. Science is just beginning to uncover how deeply interconnected our health really is. What happens in the legs doesn't stay in the legs. What happens to the heart echoes in the immune system. And what happens to the immune system can determine whether cancer remains a minor threat or becomes a major crisis. The good news is that we're not powerless. The body has an incredible capacity to heal, to rebalance, to adapt. Even after ischemia, interventions may help reverse some of the damage. The key is awareness, knowing that seemingly unrelated conditions are, in fact, deeply linked. That heart health is immune health. That circulation is defense. That keeping blood flowing might be one of the most powerful ways to keep cancer at bay. So the next time you feel a cramp in your leg after walking, or notice your feet are always cold, don't just brush it off. Consider it a signal, not just from your legs, but from your entire body. Your immune system might be listening. And it might be asking for help. In the end, this isn't just a story about mice or tumors or bone marrow. It's a story about how fragile and resilient we are. About how a clogged artery can quietly change the course of health. And about how, by paying attention to the whole body, we might find new ways to protect ourselves, not just from heart attacks, not just from cancer, but from the slow erosion of our natural defenses. The body is smarter than we give it credit for. But it needs our help. And sometimes, the best way to fight cancer isn't with a drug or a surgery, but with a walk, a better meal, a doctor's appointment. Because sometimes, the key to stopping cancer lies not in the tumor, but in the blood that flows past it. If you found this video eye-opening, don't keep it to yourself. Hit that like button, subscribe, and turn on the bell so you never miss another deep dive into the hidden connections shaping your health. This isn't just science, it's real-life knowledge that could change how you think about your heart, your immune system, and your long-term well-being. Share this with someone you care about, because sometimes, the most powerful medicine starts with understanding how your body truly works. Until next time, thanks for watching.